So let's talk about hormones. The word hormone comes from the Greek, which means to set in motion, which is a great term for what hormones do. You can think of hormones as acting like keys. So they're chemicals that are made by your glands, and they travel through your bloodstream and bind to receptors. And they fit exactly like a key in a lock, which is why if you use a synthetic hormone, you can end up with so many side effects or problems because it doesn't fit that lock exactly. A bioidentical hormone, in the way that I use the term, means it's molecularly identical to your own hormone, so it fits that lock. So it's very specific. And you can think of hormones as the language that your cells use to communicate. They're always going through your body, swimming through your bloodstream. So what do? They do a lot. They're responsible for growth and development, absolutely critical for repair of your tissues, including your skin, your muscle, and your bone. And you can see why you end up with some of the symptoms you do: bone loss, muscle atrophy, sagging skin, unhealthy skin, as your hormones decline, because hormones are critical to repair those tissues. Obviously, hormones play a role in reproduction. They play a role in your metabolism. They play a role in your energy level, your overall energy level, extremely important role in your brain function and your mood. Also immune function and blood sugar regulation. So hormones are involved in all of those areas of the body. So we're going to play Name That Gland. Anybody know what the first one is? Good. Pituitary. Second one? Thyroid. Good. Third one? Adrenals. Good. Fourth one? Good. Pancreas. And I hope you all know the last two. Those are the glands that the hormones we're going to be talking about come from. The reason that I called my book HormoneSynergy, and actually my clinic is now called HormoneSynergy, is because HormoneSynergy refers to the fact that all the hormones interact with one another and the sum total is greater than the individual parts. So hormones we're going to be talking about today: cortisol and DHEA, which come from your adrenal glands. We're going to be talking about thyroid hormone, and there are two main thyroid hormones we'll be covering: insulin, which comes from your pancreas, and estrogen, progesterone, and testosterone, which come from the ovaries and the testes. And men and women both make all of these hormones, just in different amounts. So, for those of you who like this kind of thing, this is a little bit of a review of where the hormones come from and how they interact. For those of you who this stresses out because you have flashbacks to biochemistry and failing an exam or something, just relax and breathe. You don't have to know this. This is not on the quiz, and you will not be tested on it. And there's no prizes for this. But for those of you who are geeky and biochemistry like me, here you go. Most of the hormones that we're talking about have a cholesterol backbone. So what do you think could happen if you put on a lot of Lipitor and you drive that cholesterol really, really low? You can end up with a hormone imbalance, actually. So cholesterol is made into something called pregnenolone. Pregnenolone is the precursor to make progesterone. And progesterone is actually what your adrenals turn into the stress hormone called cortisol. Remember, you don't have to memorize this. Pregnenolone is also the precursor to make DHEA, which is another adrenal gland hormone, which gets converted into androstenedione and reversibly converted into testosterone. And testosterone is converted into dihydrotestosterone, which is the potent form of testosterone. Androstenedione is also a precursor for estrone, and testosterone and estrone both get converted into the most potent estrogen called estradiol. Again, you don't have to memorize this. For those of you who are geeky, you might want to know. But here's where it gets fun. And this is basically very brief, but it is kind of fun. When you see a dashed line, there's an inhibitory relationship between the hormones. And when you see a solid line, there's a stimulatory or positive relationship between the hormones. And we're going to add a couple more: thyroid and insulin. So progesterone positively affects thyroid hormone, or has a positive influence on thyroid hormone, but it inhibits testosterone from being made into the most potent form of testosterone. It also has an antagonistic relationship with estradiol, or a balancing effect. Thyroid hormone inhibits cortisol function, and cortisol actually can inhibit thyroid function, so they have a reciprocal antagonistic relationship. Cortisol also lowers testosterone both in production and function, and stimulates insulin secretion. And insulin can lower testosterone. Insulin also stimulates androstenedione to be turned into estrogens, and DHEA helps balance cortisol and lowers it. So isn't that fascinating? And this is exactly why the longer I'm in practice, the more I believe in actually replacing every lost hormone in the right amount, and the more I believe in balance. Because if you take one hormone, look at what it can do to all the other hormones. And this is also why I'm against hormones being available over the counter. Sometimes people come into me, they're on a lot of DHEA because you can buy it over the counter, or a lot of progesterone because you can buy it over the counter. Not a good idea. You have to think about what's happening to the other cascade of hormones when you do that. Lastly, estradiol lowers testosterone, especially in men. Okay. Multnomah Falls. So a little review so that you can relearn what you know now. Hormones are chemical messengers. They're the language your cells use to communicate with one another. Each hormone is like a key which must fit its receptor, which is like a lock, exactly. Hormones are responsible for growth and repair of your tissues, your metabolism, your energy level. They're also responsible for your immune function, your brain health and mood, and blood sugar regulation. So nearly every system of the body. Your steroid hormones are made from cholesterol, and all hormones interact with and influence one another. Important concept. Hormone synergy means that hormones influence and help each other. In case you didn't get it the first 6 times I said it, I thought I'd say it again. And I like this term, the Goldilocks principle, that I came up with. It means not too much, not too little, just the right amount of hormone. Very important concept also. Every person is a unique individual. This is where we all go, duh, except for the way that most medicine is practiced. And hormone synergy is absolutely necessary for vibrant health. And life is too short not to feel awesome. That is my favorite saying. So I believe that everybody deserves to have vibrant health. These are the 5 principles that I came up with for my book, and this is number 4 if you're following along and you want to fill it in. Number 1, hormone imbalance can occur at any age, although most hormones decline with age. Aging accelerates as your hormone levels decline, and as your hormone levels decline, your health declines. Again, we're not programmed for longevity, we're programmed for procreative success. Diet and lifestyle, extremely important for hormone balance. And bioidentical hormones are best if you are going to supplement with hormones. So when it comes to hormones, they can also prevent some diseases, such as diabetes, heart disease, obesity, osteoporosis, Alzheimer's and dementia, and some forms of cancer. And we're going to be talking more about those in depth. Aging isn't optional. So this term anti-aging, I think we need to find a better term, maybe optimal aging or maybe age management. But optimal aging is optional. It's optional. You have a choice as to whether or not you want to embrace optimal aging. Optimal aging means you can slow the effects of aging. You can prevent chronic disease. You can keep your mind sharp. You're not just getting old. You can maintain an attractive body, and you can continue to experience all the joys of life. Achieving hormone synergy can keep you youthful, healthy, happy, and energized. And this is one of my favorite Randy Glassbergen cartoons. Randy is the one who did the cartoons for my book. Honey, when you left for the office this morning, you were a happy, enthusiastic, vibrant 25-year-old. You want to talk about it? Anybody feel like that? Workplace, a very common area for stress, huh? Okay, pop quiz. Again, no prizes. You don't have to answer if you don't want to, but just to reinforce what you now already know. To age optimally, you must focus on the cellular level. Great. Not the topical level. At least 66% of longevity is due to diet and lifestyle. Great. True or false, hormones influence each other. Hormone imbalance can occur at any age. Yeah, but your hormones tend to decline as you age, right? As our bodies age, hormone levels tend to... See how smart you all are? You already know all this. Supplementing with bioidentical hormones is more important than diet and lifestyle to achieve hormone synergy. Correct. Thank you. Great. And we're going to be talking about the hierarchy that I put these things in. Achieving hormone synergy may help prevent diabetes, heart disease, obesity, osteoporosis, Alzheimer's and dementia, and some forms of... Excellent. So points for whoever knows who this is and says it first. Excellent. I put that in because we're at the Hotel Deluxe. And if you haven't been here before, this hotel is beautiful. Every floor is devoted to a different director or film actor. So if you get a chance to wander, if they let you do that, it's just beautiful. We're going to talk about the sex steroids. And by sex steroids, we mean estrogens, progesterone, and testosterone. And they do kind of a dance. We're going to start off by talking about estrogen, and that's a photomicrograph of the estradiol molecule. Estrogen is an extremely powerful hormone. There are three main types: estradiol, estrone, and estriol, but estradiol is the most potent. Estrogen in women comes from your ovaries. After menopause, your adrenal glands make the precursors so you can make a small amount of estrogen, although many times when I test women, they're at 0. In men, too much estrogen can increase breast development or gynecomastia, or as some of my patients call it, moobs. I didn't create that term. It's a good one, though. Testosterone is converted into estrogen from an enzyme in fat tissue called the aromatase enzyme. And that's why you'll see men sometimes when they get the spare tire also end up with breast development. The aromatase enzyme is found in fat tissue, but it also increases just with aging. It increases with inflammation. It increases with high alcohol intake. More estrogen means less testosterone, because too much estrogen can feed back and actually lower testosterone production and prevent it from working. So what does estrogen do? And I really want you to get a sense that none of these hormones is good or bad. Everybody needs all of these hormones. It's about balance. So there is no such thing as a bad hormone or a good hormone. So what does estrogen do? Why do we even need it? It's important for the development of breast tissue and reproductive organs. That's a duh. But it also maintains heart health. Very important. It dilates and protects the blood vessels. This is true in men and women. It increases the good cholesterol, HDL. It can even lower lipoprotein A. And for those of you who are interested in healthcare providers, the references that you'll see that I included as part of your PowerPoints, and you'd have them for later, are all on my website. So if you go to our website and you go to the resources page, I now have 60-something pages of references on bioidentical hormones or on hormones that you can reference, and they're hyperlinked. So if you want to look up any of these studies, you can actually find my summary of the study or an abstract, and most of the studies I have. So if you ever wanted the actual article, I could get it to you. Let's talk about estrogen and bone. Estrogen is the most important hormone for strong bones. Extremely important. It slows bone loss, and it maintains the balance between osteoclasts, the cells that chew up bone, and osteoblasts, the cells that put bone down. And bone is extremely important. Estrogen in your skin, so it maintains skin elasticity, thickness, and moisture. This is why as your estrogen declines, you can start to get wrinkles or sagging or dry skin. It's required for proper vaginal secretion, so the vaginal canal needs estrogen. Extremely important hormone for the brain. It increases what are known as happy molecules, serotonin, dopamine, and norepinephrine. It's critical for learning and memory. Estrogen is very important for learning and memory, very important to form new memories in the hippocampus and to maintain your neurons. It's needed for attention span and focus. It protects your neurons, which are the nerve cells in your brain, from free radical damage and glutamate toxicity, so it's actually protective in the brain. And it can help prevent dementia and Alzheimer's, and may even improve Alzheimer's disease, especially if initiated within 10 years of menopause. Okay, little pop quiz. Let's see what we've learned about estrogen. Where is estrogen made in premenopausal women? Ovaries, good. After menopause, which glands are critical to normal estrogen production? Adrenals. And you can all feel smart because I think your answers are on your PowerPoint, right? I don't think I took those out. And which part of the body needs estrogen to be healthy? Yeah, a lot of parts of the body. The heart specifically, the brain, your skin, and your bone. Good. So let's talk about estrogen in men. Which hormone is converted into estrogen by the aromatase enzyme that's found in fat tissue? Testosterone, good. Estrogen in men increases with fat tissue, inflammation, and aging. Tends to increase just with aging in general. Okay, let's talk about progesterone, and that's a photomicrograph of the progesterone molecule. Progesterone is made by the ovaries after ovulation occurs. So if you don't ovulate, you don't make very much progesterone. And it's also made by the adrenal glands. This is true in men and women. And it's made by the adrenal glands in women after menopause. So when you stop ovulating, you stop making progesterone from the ovaries, you make it by your adrenals. And it's the precursor to make stress hormone. Obviously, progesterone plays an extremely important role in preparing for and maintaining pregnancy. That's why it's called progesterone, progestation. If you don't have enough progesterone, you can't maintain a pregnancy and you'll have a miscarriage. Progesterone is also very important for what we call breast tissue differentiation. So it makes sure that dividing breast cells become normal, healthy breast cells. And it also opposes the estradiol influence on the proliferation of breast cells. So very important, again, so that breast cells become normal, healthy breast cells. Progesterone also helps with estrogen imbalance. So in the uterus, this helps prevent heavy periods and the formation of uterine fibroids, helps with PMS and anxiety. It may help prevent androgen excess symptoms, so this is facial hair growth and acne in women, some maybe prostate symptoms in men, although I don't give progesterone to men. And it's the precursor for stress hormone production in men and women. Again, this is all just background information, so this is kind of the boring stuff to weed through before we get to symptoms and treatment, which is the exciting stuff, so hang in there. Progesterone, very important for your brain. It calms the brain and it actually improves sleep. So estrogen and progesterone decline with aging is part of the reason that menopausal women have so many sleep problems. And it protects the nervous system, so that's an MRI of the brain. Your neurons and glial cells in the brain actually make progesterone. They secrete progesterone. This is true for men and women. And there have been some studies giving people high-dose progesterone during the first few hours after a traumatic brain injury to actually help limit the damage and help with recovery. And the research looks very good. Also high-dose hydrocortisone. So a review of progesterone made by your ovaries, women, before menopause, after you ovulate, made by the adrenal glands in men and women, protects and calms your brain, helps with fibrocystic breast changes and breast tenderness, and it may help with prostate symptoms in men and facial hair growth in women. So let's talk about my favorite hormone, because I feel like it's the forgotten hormone for women, testosterone, and that's a photomicrograph of the testosterone molecule. Testosterone is needed by men and women. We just make different amounts. Men make 10 times as much as we do. It's made by the testes in men, obviously, and it's made by the ovaries and the adrenal glands in women. About 50-50 before menopause, and then, of course, after the ovaries quit, it all comes from the adrenals. And that is a picture of passion flower, passiflora. Many of you probably have that growing in your yard or your garden. I like it because there is a compound called chrysin that comes from passion flower that may help prevent testosterone from being converted into estrogens. But testosterone enhances libido. That's true for men and women. So libido is sex drive. When Freud talked about it, he didn't just mean sex. He also meant your passion for being in the world. You know, your reason for being here, how excited you were about life. So it wasn't just about sex. It helps with vaginal lubrication, and men absolutely need it for normal erectile function. So testosterone builds tissue. It promotes protein synthesis and the growth of structural tissues. That's why men have bigger hearts, lungs, and livers than women do. And the growth of muscle mass and improved muscle strength, which is why when your testosterone declines, you can have muscle weakness or muscle atrophy, muscle thinning. Required for lean body mass. So testosterone improves lean body mass, which means it decreases fat and increases the likelihood of making muscle. Now, you still need to exercise, but testosterone does help this in men and women. It promotes wound healing, and it helps with bone formation. So testosterone can prevent bone loss. In fact, testosterone is aromatized into estrogens in the bone, so it stimulates those bone-building cells. It also stimulates growth factors in bone, like IGF-1, and it increases muscle mass and strength, so you have a reduced possibility of falling. So it is an important hormone for the bones. Testosterone is an energizer bunny. It improves mental and physical energy and stamina, the ability to keep going. And it's also important for the heart. Low levels of testosterone are actually a risk factor for congestive heart failure. As testosterone declines, blood pressure goes up, And this is partly because testosterone aromatizes into estrogens in the blood vessels and increases nitric oxide, which causes vasodilation. So it dilates the coronary arteries. Those are the arteries that feed the heart muscle itself. And it decreases coronary artery disease likelihood. Very important hormone for the heart. Looks like Bill Clinton, huh? The old Bill Clinton before he became a vegan. Let's talk about testosterone and insulin. As insulin goes up, testosterone goes down. They have a reciprocal relationship or an inverse relationship. And testosterone may decrease insulin resistance and help prevent diabetes. High insulin actually worsens insulin resistance in men. I've never seen a diabetic patient with normal insulin or with normal testosterone. Never. Every single one I've tested have very low testosterone. Also an important hormone for the brain. So you've learned about estrogen and how important it is for the brain. You've learned about progesterone and how important it is for the brain. Let's talk about testosterone and its role in the brain. The aromatase enzyme is also found in the brain. It's responsible for converting testosterone into estrogen in the brain, and actually this is what causes masculinization of a fetus. The differences in male-female brains may be due to different testosterone levels. Higher testosterone, more estrogen in the brain, more male-like brain. The male brain, however, is larger overall, but the corpus callosum, which is the area of the brain that connects the two hemispheres in women, is actually larger. So the take-home is men have bigger brains but less connection between their hemispheres, which we've all probably experienced that before. Testosterone improves thinking, again, in part due to conversion to estradiol in the brain. And the reason I point this out is because there are a lot of men on aromatase inhibitors from anti-aging doctors, and I think there's an important role for those medications, but I think we need to think about what it's doing to the brain. So if your estrogen level gets driven too low, that's not a good thing, because those medications cross the blood-brain barrier and prevent testosterone from being made into estrogen in the brain, which is not good for the brain. So your brain needs estrogen, men and women. It's responsible for spatial sense, so your ability to parallel park, verbal fluency, and memory. Testosterone also prevents depression and improves well-being. This data goes back to the 1930s in Germany. And it affects serotonin, especially dopamine, and acetylcholine. So dopamine is your focusing neurotransmitter. Very important for mental sharpness. So as testosterone declines, sometimes you find yourself struggling, or you just can't come up with something, or you can't stay on task. Assertiveness. This is true for men and women. So something that can happen when your testosterone declines is you become less confident, less able to make decisions. You start to waver more. It's important for memory, the ability to concentrate and focus, and protects against depression. Let's talk a little bit about testosterone and Alzheimer's disease. Testosterone has been shown to protect against Alzheimer's and cognitive decline, so does estrogen. Low-free testosterone is actually a risk factor for Alzheimer's disease. This is now true in women also. Most of the data is on men. And testosterone reduces the secretion of the Alzheimer's plaque, the beta amyloid plaque that's made that is responsible in part for some of the symptoms of Alzheimer's. There's been a small pilot study using testosterone in Alzheimer's groups in a small cohort of Alzheimer's patients, and they did improve on testosterone replacement. Okay, little testosterone test so you can feel smart and know what you already know. Women don't need testosterone, true or false? Thank you. Men make more testosterone than women. Yeah. Low libido can be due to low testosterone. Erectile dysfunction can be due to low testosterone. Yeah, it's not always a Viagra or a Cialis deficiency. Sometimes it's just from low testosterone. And osteoporosis can be associated with low testosterone. True. Testosterone protects the hint, it's a very important muscle. Heart, good. It enhances insulin sensitivity and may help reverse diabetes, good. And the brain needs testosterone. Low levels can lead to problems with memory, and inability to focus, depression, and cognitive decline, Alzheimer's, dementia, yeah. Okay, so you all should have 3 little postcards in your packets. If you look in your packets, and we're going to do a little game now called HormoneSynergy Jeopardy. You don't have to play if you don't want to play. But if you want to play, you have the opportunity to win valuable prizes. That spikes your dopamine. I don't know. So here is the question. What are the 3 theories of aging discussed at the beginning of the seminar?
Is this open book?
It's totally open book. You can even ask your neighbor if you're really stumped. And please put your name on your card so that if you win, I'll know who to give a prize to. If you get it wrong, we will not read your name out loud. Okay? We don't want to humiliate anyone.
What,
Yeah?
Two winners?
I think 3 winners.
3 winners?
The 3 theories on aging that we talked about at the beginning. What page are we on? Oh, there's 2 questions. There's another question. So you have to get one of these right. Name 3 hormones that are important for brain health. So either the 3 theories that we talked about at the beginning that are responsible for aging, or 3 hormones that are critical for brain health. And then do you have a box to collect?
Yeah, she's good.
Oh. Oh, good. So if one person could be a leader and gather them for your table, maybe fold them in half.
Yep, fold them in half, please. And then Katie will come around with a box and just put them in the box when Katie comes around your table. And so we're going to pick 3 winners, and each winner will get a box of the Zymogen Organics Whole Food bars. Really good. And you get like 12 bars in each box.
That one, I opened that and took one.
And the doctor actually opened one and took one out of this one. So we'll replace
I'm sorry. I ran here and I didn't think ahead. I didn't have any food. Okay, are you guys all ready? Do you need help? Does anybody need help? I want you to get it right. Okay. This is a great way to learn writing. And you only have to get one of the questions right. So those of you who are overachievers, you only have to get one. So you guys all done with them? It's okay. Thank you. Everybody done? One more?
All right.
Anybody else want to turn theirs in? You can only do it one.
Oh, 1? Oh, well. I can't follow directions either.
That's okay. Okay. Pick 3. Oh, they did? Oh, that's okay. Okay. Ooh, can someone help me read that? Ivory Connolly? Say Ivory? Somebody's last name Connolly?
Is that you?
Raise your hand, please.
It's what?
Tracy. That says Tracy, I'm sorry. Tracy. Yay, good job, Tracy. Tracy learned that the 3 hormones necessary for brain health, testosterone, progesterone, and estrogen, also DHEA, thyroid, growth hormone, melatonin, we haven't talked about those. You didn't have to know those. And Stephanie Richardson. Excellent. Stephanie has informed us the 3 theories on aging that we covered at the beginning of the seminar: telomere shortening, free radical damage, and hormone decline. Where's Stephanie? Oh, good job, Stephanie. And blank. So somebody put in a blank card. I don't know what that means. They have a clear mind. Okay. Kathy Labs. Yay, good job, Kathy. Okay, so those all get recycled. And this is number 5 for those of you doing the fill in the blank on your handout. Just as your reminder. We have one more Hormone Synergy Jeopardy opportunity before we take our snack break. So there are more chances to win exciting and valuable prizes.